welcome to Mal and Tad YouTube channel, and I have posted another skill video. Check it out.
Hi, my name is Mahalet. Welcome to your pregnancy prenatal visit. I will be the nurse today. My name is Mahalet. I will be the nurse who will facilitate your prenatal visit. Congratulations on your pregnancy and thank you for coming. I'm gonna go ahead and ask if my patient is safe at home and also if they have any question before we proceed. And to stop me anytime if I'm going too fast or if things are not clear, then I'm gonna give her a general information about the first visit, how long it's gonna take and stuff. And the first thing that today I will be discussing with you is about the specific foods that should be avoided and you should take precaution. Some are mercury fish. High mercury fish can be toxic and affect nervous system, kidneys, and also can cause some serious developmental problem to the child as well. And also uncooked eggs, meat, fish, just because they're high, they will increase a risk of exposing to bacteria and parasites, so high risk for infection. Excuse me. And also processed food, because they lack the nutrient that is supposed to be there, the necessary nutrients, so it should be avoided. It's at risk for hypertension or any other complication. And also avoiding high mercury fish, including swordfish, tuna. You should be taking precaution about those foods too. Raw fish, shellfish, because with bacteria and parasites, so they're high risk for infection. They can cause adverse health effects and harm both you and the baby. And I mentioned anything that is uncooked, fish, meat, egg. Like as a general rule, meat should be cooked all the way through. And also raw eggs may be contaminated with salmonella, and they may put you or your baby at risk. So be sure to cook it thoroughly. That is one thing you need to pay attention to, and you make sure you limit your caffeine intake to about 200 milligram per day, which is about 2-3 cups for coffee, because high caffeine intaking during pregnancy may limit baby's growth because of low birth weight. So just be mindful about that as well. And another thing is you have to be careful of fruits and vegetables. Yes, fruits and vegetables are good, but sometimes may be contaminated with bacteria, including toxoplasma. It's important to thoroughly wash all the fruits and vegetables with plenty of clean water before starting to eat them. And another thing is don't consume unpasteurized milk, cheese, or fruit juice, or any of these foods that will increase any bacterial infection. And as I mentioned earlier, eating processed food during pregnancy can increase a risk of excessive weight gain. So we don't want that weight gain to happen. And also gestational diabetes, which is very common complication and another complication as well. So it will have a long-term health complication for you and for your child. Another thing that I want to talk to you is about over-counter medications and supplements that can be used while pregnant, and those that should be avoided while pregnancy. Safe supplements during pregnancy like iron, calcium, prenatal vitamins, magnesium. These supplements are known to promote healthy pregnancy during your pregnancy. So they play a huge role on normal body for the baby and for your development, especially for the baby development. Unsafe supplements during pregnancy can be vitamin A. Excessive vitamin A may cause to the unborn baby to develop serious birth defects, and also vitamin E that increase the risk of abdominal pain and premature rupture of the amniotic sac. So you should be mindful of that too. And also environmental exposures to avoid while pregnancy, exposure for pest sites, because it will increase a poor prenatal growth. Birth defects, leukemia, and impaired neurodevelopment are all this caused by environmental exposure like pesticide. Anything that can lead exposure will put you at high risk of spontaneous abortion and also radiation. Pre and during pregnancy, it's a risk. Has can be going to a doctor to see your doctor and getting an X-ray. So it's a very risk for congenital defect and a child cancer as well. So make sure if you have to do, let's say you wanted to do a chest x-ray, which they usually ask if you're pregnant or not, so make sure you mention that you're pregnant and make sure you're aware of that. If they didn't ask, now you know, so make sure you tell them, oh, I'm pregnant. So because we don't want that, we don't want to take that risk, right? And another thing is air pollution that would increase low birth weight and birth defects as well. And another thing that I wanted to mention to you is to be taken precaution is about alcohol and tobacco and like substance use while pregnancy. So like most research shows that to use tobacco or alcohol or any illicit drugs or misuse of any prescription drugs by pregnant women who can have severe health consequence for the infant. So this is because the substance passes through the placenta and it's gonna affect the baby too. So just be aware of this alcohol and tobacco, all this drug, because it can increase the risk of miscarriage, fetal alcohol syndrome for the baby. So make sure you take a good precaution on that as well. And now I want to talk about with you is travel. Let's say you wanted to travel. So every time you wanted to travel, make sure you advise your doctor. Puts contractions socks to prevent blood clot from being sitting for a long time. We don't want you to develop any blood clot, because if you do, blood clots can go to brain, hurt, and affect the organs, so we don't want that to happen. Timing for the safest travel is the second trimester. It's the safest to travel, but still, if you want to travel after that, make sure you talk to your doctor. That way you can have a preparation for travel, like you can purchase your travel insurance, and make sure you always bring your medical records with you, and that's very important. And make sure you stay hydrated, bring sanitized wipes with you, because we don't want it to catch any viruses or you don't want it to get sick. So make sure you took all that precaution for you. And there are some places that are not safe to travel, so avoid traveling to places that has like high risk of malaria or TB, just as a concern. And also always discuss the risk of sitting for prolonged period of time during travel, and what measures like can be taken. That's what we're gonna be discuss next, because prolonged sitting during pregnancy can increase, as we mentioned earlier, the risk of clotting. So can develop a risk of clotting. So we have to be sure that the legs, you have enough circulation, because the clot is forming, and the deep veins, which is mostly common, called deep vein thrombosis. This can circulate in large in parts of in the body, as the lung, brain, and heart, like I mentioned earlier. So just make sure you take a good precaution of that. And as I mentioned earlier, you can have your compression socks on for when you have a prolonged travel or seating time. And also I would advise you to do frequent leg exercise. That would help to circulate, to walk regularly, and avoid being dehydrated. Excuse me. Drink a lot of water and minimize alcohol and caffeine intake as well. And if you have any increased clotting, make sure you advise your doctor. And also I wanted to talk about when can you visit the dentist. Most dental services and procedures include dental x-ray, because they have to take a picture of the tooth, filling for everything. So it can be done like during safely at the second or third trimester. And also just make sure, if you wanted to do this, advise your doctor. And also make sure you always tell them that like you're pregnant, so that those rays doesn't affect you or the baby. Pregnancy, it can also lead to a dental problems in some women, including like gum disease, tooth decay. That's very common to happen during pregnancy because hormones affect the gums and the teeth. So brushing teeth twice a day with fluoride toothpaste, visiting your dentist regularly to keep your teeth clean is very important. And also like we one of the common sickness you feel during pregnancy is nausea and vomiting. So vomiting can actually damage teeth due to its acidic content of it. So just to be careful of looking after your health is very important as well. Do you have any question? Feel free to ask. Okay, good. And okay, so anytime you wanted to talk to us, we're always gonna be here. Thank you so much for listening to me. Thank you. Okay, thank you for watching. I hope you guys find this very helpful. And also, as always, if you have any questions, ask away and I will be so happy to help. Okay, bye. Stay safe.